Interleukin. Interleukin 1 is macrophages, macrophage and neutrophil migration, and increase in acute phase reaction, fever and shock. Interleukin 2 includes T cells and T cell activation, and increase in macrophage and NK cell activity, and increase in B cell growth. Interleukin 3 includes T cells, hematopoiesis. IL-4 includes Th2 cells, increase in B cell growth, increase in Th2 cell differentiation, and increase in isotype switching to IgE. IL-5 includes Th2 cells and increase in differentiation of eosinophils, and increase in isotype switching to IgA. And interleukin 6 includes macrophage and increase in T and B cell growth, and increase in osteoclast activity and acute phase reaction and fever. IL-8 includes macrophages, T cell, and it increases neutrophil activity and chemostasis. And IL-10 includes Th2 cells, increase in B cell functioning and decrease in Th cell differentiation, and decrease in cell-mediated immunity and APC activity. And IL-12 is macrophages, increase in Th1 cell differentiation, increase in NK cell and CD8 plus T cell activity.